Hi folks, and welcome to Sega City. I want to tell you about my friend. He comes to visit me every day. He is Myalgic Encephalomyelitis friend. Some days he's a pain in the neck, some days he's a pain in the back, some days he's just exhausted. But he's Myalgic Encephalomyelitis friend. Now, I want to give you a bit of perspicacity into chronic fatigue syndrome, as it's called. We're going to use a bit of sagacity. Man, these are big words. Okay, so we're going to use a little bit of perspicacity and sagaciousness to have a look, to give you some sapience, insight into chronic fatigue syndrome, as it's commonly known as, which is a bit misleading because it doesn't exactly explain the illness, and a lot of people don't like to use those words. That's from Wikipedia. Chronic fatigue syndrome is a common name used for a group of illnesses that are defined by persistent fatigue accompanied by other specific symptoms. Apart from being referred to as myalgic encephalomyelitis, it's also called post-viral fatigue syndrome. There really isn't a box where you can put all the symptoms, causes, cures, whatever into in an alphabetical order and say, here you go. Some of the symptoms are unrefreshing sleep, muscle, joint pain, sore throat, headaches, cognitive difficulties, that's me, severe mental and physical exhaustion, now that's me to a T. Symptoms in a previously healthy and active person. When I got chronic fatigue, I was cycling 22k a day out from Takapuna all the way out to Long Bay, Browns Bay, Long Bay, and in the end I basically had to push my bike home one night and I just couldn't do it anymore. Muscle weakness, now that's, yep, I agree with that one. Austere, and another big word coming up. Increased sensitivity to light, okay, because I used to hang like sheets over the curtains in my bedroom. This is when I was 18, and couldn't go to sleep unless the room was pitch black, so that explains that. Okay, there's another big word coming up. Orthostatic intolerance. Digestive disturbances. Doctors have told me that my liver's not functioning properly. Things like that. Depression, obviously. Cardiac and respiratory... cardiac and respiratory problems. Now, when I had my first major panic attack, I dialed 111. My cousin was there on standby. They hooked me up to this machine because I swore black and blue I was having a heart attack, which I wasn't. And it, you know, they spend all their time saying, look, you're on the machine, your heart's functioning properly, it's not a heart attack. I didn't even know what a panic attack was then. But you see, when panic attacks come, it's almost as if you can't breathe. You can breathe, but you feel, your mind tells you you can't. So that's respiratory problems. Wow, that's cool. I'm just reading this all off Wikipedia and I'm learning at the same time. That's how I learn. They reckon that there's between 7,000 and 3,000 cases of chronic fatigue for every 100,000 adults. They estimate there's about 1 million Americans who have it, and 250,000 people in the UK have it. It occurs often in women more than men and is less prevalent among children and adolescents. The quality of life is particularly and uniquely disrupted in chronic fatigue syndrome, which is why when I do the making of, or the behind the scenes version of this, you'll see that most of my work is done lying in bed with the computer right there next to me, and I work 8 hours, 10 hours, whatever, just lying down and doing that. That's in the middle of winter. Something I have to add, when there's no sunlight, see the sunlight's just come out after 2 days of rain, so I'm hypo again. I'm back to ADD me. In the winters, my energy level drops regardless of whether the sun shines or not. I mean, just it has to be about 20 degrees for me to become active during the day. It's just one of those weird things. I'm like a battery. I've got to be charged. And doctors have given me, one doctor prescribed me vitamin D, a brown vitamin D tablet that I took once a month, and it did nothing. But I realized if I sit in the sun for an hour, just sit and read or whatever, then I become energized and my ADD kicks in. So, there is agreement on genuine threat to health, happiness and productivity posed by chronic fatigue syndrome. Just another weird one because I'm such a weird person. Happiness. Now if I sing for an hour a day, my next day's absolutely fine. If I forget to sing or I don't sing, I'm wiped out completely. Plus if I eat McDonald's like I did yesterday, my energy level drops straight away. Like I have to sleep my meal, my takeaways, I sleep them off, which is a waste of time. So I'm trying not to do that, but it's easy because there's a McDonald's just walk down the road and away you go. But yeah, you've got to use a bit of perspicacity. Another big word there. Alright. Ooh, I love these big words. When you're getting into the medical side of this, there's these 30-letter words because they don't know what they're talking about, so they just use up big, huge words. Right. Researchers and patient advocates promote different nomenclature, diagnostic criteria, etiologic hypothesis and treatments, resulting in controversy about many aspects of the disorder. The name chronic fatigue syndrome itself is controversial, as many patients and advocacy groups, as well as some experts, believe the name trivializes the medical condition and want the name changed. Under cognitive functioning, there's something here that doesn't make sense about decreased attention, memory and reaction time. Judged from a range of 0.5 to 1 standard deviations, blah blah blah. What does that all mean? Processing speed and functionings entailing working memory over a long time periods for monitoring extensively impaired, obviously. In other words, simplify the whole paragraph, short-term memory loss. That's what I got. Can't even tell you what I had for dinner last night. Another big word, perceptual abilities, motor speed, language, reasoning and intelligence. In other words, sagacity, sapient, perspicacity, acuteness. Any other big words? Astuteness, judiciousness, and prescience. Prescience. I don't know how to pronounce that one.
Prescience.
Anyway, so according to this paragraph, none of that's altered. Of course, on down days, I could never pronounce any of those words at all. It would take me a day and I'd give up anyway. So, rightio, let's go down the page a bit. Treatment. There isn't any. Many people do not fully recover, obviously. Cognitive behavioral therapy. Been through that. Graded exercise therapy. Multiple randomized controlled trials. 2 large surveys of patients indicated that pacing is the almost helpful intervention or is considered useful by 96% of participants. And I didn't even have to read this paragraph to know that, because I burnt myself out by basically doing everything. Playing guitar and filming and taking photographs and doing everything all at once. So I burnt out once, I'm not going to burn out again. Which is why in Rotorua I'll be pacing myself to the point of it'll be annoying to people because they'll think I'm being lazy or I don't want to do it. You just got to put up with that sort of stuff anyway. That's about it for now, is it? Cognitive behavioural therapy. It's a psychological therapy used to treat chronically ill patients. Never fixed me. What the? Can be useful in treating some CFS patients. Since the causes are unknown, patients understand their individual symptoms and beliefs and develop strategies to improve day-to-day functioning, whatever the cause of the symptoms. It's also thought to help patients by removing unhelpful illness beliefs which may perpetuate the illness. Alright, so in other words, it's all in your head, is it? What the? Okay.